Hello everyone, welcome back to our YouTube channel Dental Mnemonics, the channel where learning is smart and fun. We are excited to bring you another round in our quiz series. After the grand success of our general round, today we are diving into the Jeopardy round. We'll be covering some awesome topics, questions from What's My Stain, DOM path, Heme path, Sinonasal path, and thyroid and parathyroid tumors. So each section will have 5 questions, but since this video might get a bit long, we will split it into 2 parts. Today we will tackle 3 questions from each section, and in the upcoming videos we will finish with the remaining questions. So here are the rules. You will get 5 seconds to answer each questions. Each correct answer will earn you 5 points, plus I have sprinkled some bonus questions in between to help you rack up some extra points. So excluding the bonus, you can score a maximum of 75 points today. So what are we waiting for? Grab your pen and notebook, get ready, and let's jump into the Jeopardy round of oral pathology. So the first question from What's My Stain, question number SQ1 is: what stains with methanamine silver? You have 5 seconds to note your answer. I'll repeat the question. What stains with methanamine silver? So let's reveal our answer. The correct answer is it's the carbohydrates of fungal wall. So the methanamine silver stains carbohydrate in fungal cell walls black, highlighting organisms like Candida and Aspergillus. So I repeat, like what stains with methanamine silver? It's the carbohydrate of the fungal walls. So if you got this correct, earn yourself 5 points. So let's go to the first question of DOM path. The question is, which is the most common skin tumor in Muir-Torre syndrome? And just to recall, I have discussed about Muir-Torre syndrome in my video in keratoacanthoma, as it falls in one of the syndromes associated with keratoacanthoma. So the question again, which is the most common skin tumor in Muir-Torre syndrome? So if you know the answer, please note it. So let's reveal our answer. The correct answer is sebaceous adenoma. So the most common skin tumor in Muir-Torre syndrome is sebaceous adenoma. And talking about Muir-Torre syndrome, it's a variant of Lynch syndrome characterized by a triad of sebaceous skin tumors, keratoacanthoma, and internal malignancies, most commonly the colorectal cancer. So if you want to know more about syndromes related to keratoacanthoma, then you can revise it in my previous video. So let's go to question number 1 of Heme path. So the question is, where is the translocation in mantle cell lymphoma? So I want to know the translocation in mantle cell lymphoma. I hope you have noted your answer. So let's reveal our answer. The correct answer is the translocation in mantle cell lymphoma is in T1114, also Q1332, involving the CC and D1 or cyclin D1 gene on chromosome 11 and IZH gene on chromosome 14. So the translocation in mantle cell lymphoma is T1114. And if you want some mnemonic to memorize this, then you can comment down in the comment section and I can make another video regarding it. So just to add, it's T1114 but also Q1332, and you can memorize this, the number 13 and 32, because it seems familiar, right? Because it's the subtype of HPV that we see in X disease or focal epithelial hyperplasia. So the translocation in mantle cell lymphoma is T1114, also Q1332. So if you got that T1114 correct, then earn yourself 5 points. But if you also got that Q1332 correct, then earn yourself a bonus 2 points. So let's proceed to our other question. So the first question related to sinonasal path is, so I want you to name this lesion. It is infiltrative, it has a herringbone growth pattern, It stains positive with S100 and it commonly contains invaginations of benign surface epithelium. So what's the name of this lesion? The question again, it is infiltrative, it has a herringbone growth pattern, it stains positive with S100 and commonly contains invaginations of benign surface epithelium. So I hope you have noted your answer. The correct answer for this question is it's the biphenotypic sinonasal sarcoma. So biphenotypic sinonasal sarcoma is an infiltrative spindle cell tumor of the sinonasal tract which shows herring pattern, which stains S100 positivity and has benign surface epithelium entrapped in invaginations. So don't forget this entity. So let's go to first question related to thyroid and parathyroid. So the question is, I want you to name the thyroid lesion that stains with Congo red. And just for bonus, if you know the product that stains with Congo red, then on yourself an extra bonus 2 points, and I will reveal the answer. So once again the question, which is the thyroid lesion that stains with Congo red? So the correct answer for this question is it's none other than medullary thyroid carcinoma. So the medullary thyroid carcinoma, it often harbors the red proto-oncogene mutation, especially in familial cases of MEN2A and MEN2B. And for the fun fact, like I said, the product that stains with Congo red is none other than amyloid. So the amyloid seen on the Congo red staining is derived from calcitonin secreted by neoplastic parafollicular C cells. So don't forget this, that medullary thyroid carcinoma is the lesion that stains with the Congo red stain. If you got that correct, then on yourself 5 points. So let's go to the second group. So the second question from what's my stain is. So how do immature T cells stains with CD3? I want you to name the pattern. Is it cytoplasmic or is it membranous? Question once again. How do immature T cells stains with CD3? I hope you have noted your answer, and the correct answer is it's the cytoplasmic staining, because the immature T cells, they show the cytoplasmic staining with CD3, while the mature T cells, they show the membranous staining. So don't forget this, immature they show the cytoplasmic and the mature T cells they show the membranous staining. So if you got that correct, on yourself 5 points. So let's go to question number 2 related to DOMPATH. The question is, which is the most common mutation in acral lentiginous melanoma? So we know that usually all melanomas, they usually have the BRAF mutation. So is it the BRAF, or we have some special other mutation that occurs in acral lentiginous melanoma? I hope you have noted the answer, so let's reveal our answer. So the mutation that we see in acral lentiginous melanoma is the KIT mutation, which drives the tumor growth by activating tyrosine kinase signaling pathways. So remember, usually the common mutation in other type of melanoma is the BRAF, but for acral lentiginous melanoma, it's the KIT mutation. So if you got this, on yourself 5 points. So now the second question related to HemPath. The question is, I again want you to name this lesion. There are intraepidermal nest of atypical lymphocytes. So what is the feature that is described for, I want you to name the lesion that these features are seen in. So in which lesion do we see intraepidermal nest of atypical lymphocytes? And if you know the name of the microabscess as well, then on yourself the extra 2 points. So let's reveal our lesion. The lesion is none other than mycosis fungoides, and the abscess that I'm talking about is Potrier microabscess. So mycosis fungoids, they are characterized by intraepidermal nest of atypical lymphocytes which are known as porphyria microabscess, which are the collections of malignant T cells within the epidermis. So if you got mycosis fungoid is correct, earn yourself 5 points, and if you knew about the porphyria microabscess, then earn yourself extra 2 points. So let's go to question number 2 related to sinonasal path. The question is, which sinonasal carcinoma harbors frequent IDH2 mutation? Question once again, which sinonasal carcinoma harbors frequent IDH2 mutation? And for your information, like IDH mutation is common in some kind of sarcoma. If you know the subtype of sarcoma, then earn yourself 2 points. So let's reveal our answer. So the sinonasal carcinoma which harbors frequent IDH2 mutation is the SNOC or sinonasal undifferentiated carcinoma. So they frequently harbors IDH2 mutation which are most commonly seen. I said there's one subtype of sarcoma which is the chondrosarcoma. So if you got that correct, the SNOC, earn yourself 5 points, and if you got the chondrosarcoma part correct, earn yourself a bonus 2 points. So let's continue with our quiz. So now we are in the second question related to thyroid or parathyroid tumors. And the question is, when in a pinch, how can thyroid and parathyroid tissue be distinguished on frozen section? I just want to know how we can differentiate the thyroid and parathyroid tissue on frozen sectioning. What's the main characteristic to determine it? So I hope you have noted the answer. So let's reveal our answer. The correct answer is calcium oxalate crystals. So they appear as refractile, colorless, needle-shaped structures in parathyroid tissue and are absent in thyroid tissue, making them a helpful distinguishing feature during frozen section. So don't forget this information, like to differentiate thyroid and parathyroid tissue on frozen sectioning, the calcium oxalate crystals really helps because they are present only in parathyroid tissue and are absent in thyroid tissue. So if you got this correct, earn yourself 5 points. So now we are on to the last group of our quiz. So the third question related to what's my stain is, what is the other name for CD207? So if you know the other name, then earn yourself 5 points. But if you know like for which lesion like specifically we run this staining, then earn yourself a bonus 2 points. So let's reveal our answer. The other name for CD207 is Langerhans. So it is a protein expressed on Langerhans cells that helps form the Burbeck granules, which are characteristic rod-shaped organelles seen on electron microscopy. And the lesion that I am talking about, which stands for CD207, is LCH or Langerhans cell histocytosis. So it stands positive for CD207 or Langerhans along with CD1A and S100. So if you got the Langerhans part correct, earn yourself 5 points, and if you knew the lesion was for Langerhans cell histiocytosis, then earn yourself a bonus 2 points. So let's continue with our down path question number 3. So the papillary mesenchymal bodies are a feature of which tumor? I just want to know, like, the papillary mesenchymal bodies are a feature of which tumor? So I hope you have noted the answer. So let's reveal our answer. The correct answer is the papillary mesenchymal bodies. They are the feature of trichoblastoma or trichoepithelioma, representing the primitive follicular mesenchyme and helping to differentiate it from basal cell carcinoma. So papillary mesenchymal bodies can really be helpful in order to differentiate trichoblastoma from the basal cell carcinoma histologically. So if you got this correct, earn yourself 5 points. So let's continue with the third question of Hempath. And the question is, I want you to name this process. It is a diffuse large B-cell lymphoma appearing as progression of CLL. So I want you to name the process in which there is the diffuse large B-cell lymphoma which appears as progression of chronic lymphocytic leukemia. What's the name of this process or transformation? So I hope you have noted the answer. So the correct answer for this question is, so the process is called Richter transformation. The similar Richter that is used to measure the earthquake, the Richter scale. So it's the Richter transformation, where the chronic lymphocytic leukemia CLL progresses to an aggressive diffuse large B-cell lymphoma or DLBCL. So the transformation in which the CLL, which progresses to more aggressive form of lymphoma like the diffuse large B-cell lymphoma, it is called the Richter transformation. So if you got this correct, earn yourself 5 points. So we are nearly at the end of our quiz part 1. So the penultimate question for today, the sinonasal path, question number 3 is, what is the most common polypoid lesion in the sinonasal cavity? I want you to name me the most common polypoid lesion in the sinonasal cavity. So let's reveal our answer. So the most common polypoid lesion in sinonasal cavity is inflammatory sinonasal polyp, which arises due to chronic inflammation and edema of the mucosa. So if you got this correct, earn yourself 5 points. So I hope you are finding this quiz interesting. Before we come to our final question, so our final question today, question number 3 from thyroid and parathyroid is, so a parathyroid carcinoma is directly invading thyroid and adjacent fibroadipose tissue. What is the PT category? So I want you to name me the PT category in which a parathyroid carcinoma is directly invading the thyroid and adjacent fibroadipose tissue. So the correct answer for this question is, it is the PT2 category. So the parathyroid carcinoma directly invading the thyroid and adjacent fibroadipose tissue is classified as PT2, indicating local extension beyond the parathyroid gland but limited to adjacent tissues. However, PT3, it involves more extensive invasion into surrounding structures like the esophagus or the trachea. So note this down, the PT category for this question is PT2. So if you got this question correct, earn yourself 5 points. So please comment down your score in the comment section. So that's a wrap for today's quiz. I hope you enjoyed this fun way of testing your knowledge in the field of oral pathology. If you want us to cover any other topics related to dentistry, just drop your suggestions in the comments section below. Don't forget to like the video and subscribe to the channel. It really motivates us to bring you with more fun quizzes and content, not just in oral pathology but across all dental fields. So until next time, take care and goodbye.